Good afternoon, everyone. Thank you all for joining us today. We're so pleased to have you here and feel very fortunate to be co-hosting once again with Dr. Dori Carlson. As the former president of the American Optometric Association and the owner of Heartland Eye Care, Dr. Carlson knows firsthand how crucial patient engagement and communication are for growing a successful practice. With that said, Dr. Carlson, I will turn it over to you so we can get started.
Thank you. Welcome, everybody, and thanks for joining us today. If you know me at all, lots of my conversations lead to webinars, lectures, discussions. And I was having a conversation a few months ago with someone, and we were talking about patient engagement. And there was some statistics that were said about how not only does it improve loyalty, but it actually can add to the bottom line. And I thought, really? So I started doing some research. So today I just want to share some of the things that I've learned and kind of what we can expect or what we maybe should be considering when we're trying to involve patients and engaging them in our practices. I've been a longtime user of RevolutionEHR. I believe we joined, I should know this date, and now I'm putting myself on the spot, but we were 2005, I believe, is when we joined Revolution, and I may be wrong on that, but it was a long time ago. I think we figured out that we were office number 5 or number 7 or something of that nature. So this is what I've learned. What does it mean by patient engagement? So, we start out with the definition most of the time. In 1989, the federal government set up a program for the Agency for Healthcare Research and Quality. And it's out of this agency that has evolved all of these years since 1989. And what they do is they're responsible for providing evidence-based information for how we're dealing with healthcare delivery and healthcare policy. And according to the AHRQ, involving patients in their decision-making of their healthcare is really what patient engagement means. And why does it matter? Because we're talking about improving people's experiences with our offices. We're talking about improving outcomes. We're talking about reducing costs. And I recently joined our hospital board, and our local hospital board talks about all these things all the time about how they can be more efficient, how they can reduce costs without sacrificing on the patient experience. A 2017 study that I found actually studied patients who participate in their healthcare report higher levels of satisfaction with their care, have increased knowledge, more realistic expectations, and here's the biggest thing is they're more compliant with their care options. How many times have you had somebody who you started on a glaucoma medication and maybe came back a little bit later and wasn't really taking it very regularly or didn't really understand because they didn't feel any different because of that eye drop that you prescribed, and it really didn't seem to make any difference to whatever they were seeing because they didn't quite understand it. And I always stop myself if that ever happens and go back to the beginning about explaining what exactly the disease is and making sure they're part of that education process. So patient engagement actually boils down to like 5 things. It's about establishing that vision, creating that culture of engagement, employing technology, which we'll talk a little bit about all of these, empowering our patients, and being ready to evolve for whatever changes might be happening. And that whole process is referred to as patient engagement. And I mentioned before that, number 1, we're going to talk about is establishing that vision. So tracking your key performance indicators. We do this every single week at our staff meetings. In fact, I did a whole nother webinar that talked about engaging people in staff meetings. But we track revenue per patient. We track revenue per contact lens fits. You cannot change that which you don't measure. And so what you want to do is consider what you want for outcomes. And again, like I talked about hospital, there's lots of data with hospitals. I have troubles finding data specifically to optometry, but hospitals are great for this. They look at readmission rates. They look at infection rates. They look at patient satisfaction surveys, how happy people were with the care that they were provided. And I think that really speaks a lot for what we can be looking for in our offices. Do you do patient satisfaction surveys? We haven't done them in a long time. And if there's anything else you'll learn about me is I don't have all the answers. I try to be as authentic and transparent as possible. But every time I do something like this, it reminds me that maybe we should be doing patient satisfaction surveys more than just tracking our metrics. The second thing is creating that culture of engagement. I did a whole other webinar about culture and how to create a culture, a positive culture in your office as opposed to a negative culture. But it's a lot about staff training. It's about making sure that our care is patient-centric and that we put the patient first in that part of it. It's about providing excellent education to patients. The more they're part of those decision-making processes, the more they're engaged. Again, another data for hospitals. Healthcare organizations with superior patient experience have a 50% higher margin than those who just provide average experiences. They have tracked this, and I saw multiple studies where they looked at this, and it's kind of interesting that makes sense, I suppose, but the happier the people are with their healthcare, with the part of their decision-making process, actually those institutions actually make higher profit margins. The third thing is employing technology, and we're going to spend a little bit of time about this. Utilizing technology is about simplifying the process. What can we do in our offices to simplify and make everything a little bit easier, a little bit more tuned in, and how can we use technology in a fashion that patients expect it, like it, easy to use, patient-friendly, and alleviate some of the issues that happen in our offices. And why is that necessary? Labor supply. If we were in a room, I would have you raise your hands and say, how many in here are looking for employees? How many people are struggling to find employees or retain great employees? It seems like it's a perennial issue. Our offices, we are finally in a good spot, but it seemed there for a few years, we were just constantly down that one person. And so we're actually in a good place at the moment, but a lot of places aren't. In fact, if you look at the 2024 labor statistics from Manpower Group, 7 out of 10 employers are looking for suitable employees. That means that 70% of the labor shortage is currently sitting at 70%, which is pretty hefty when you think about it. And granted, this is across all spectrums. It's not just healthcare, but it's something that's definitely out there as far as part of an issue for all of our offices. According to the U.S. Chamber analysis, they've been tracking data for job openings and unemployed workers for years, with data going back to 2004. And granted, there's been areas of recessions that we've had, 2008, and obviously in 2020 with the pandemic. But where we sit at right now is that we have far more job openings than we have unemployed workers, which speaks well, I guess, for the economy in some respects, but it doesn't make our jobs any easier when we're trying to figure out how to do this and provide stellar experiences when we're actually down employees in our offices. So what can we do? Oh, this is another statistic I found. 2021 study, 8,000 people interviewed who had recently received healthcare in the last 12 months. They were asked the ease of navigation and which of the following reasons why you switched or stopped seeing your previous provider. And 89% of them said it was difficult to do business with the office. They had a bad experience with the front desk or administration staff, or the digital online service and support solutions didn't meet their needs. I think it's kind of funny. I don't know about you, but every time I go into an office, I just recently had some dental work done, and I'm just really analyze every little experience that I have when I go into somebody else's office. And so as I'm putting together this talk and about the digital services that were available and what my experiences were like dealing with a person at the front desk, it's true. It's so very true. As a consumer of healthcare, certainly I look at those things. And access is the top factor for driving patient selections of new providers. So 70% of the people, convenient location and hours, quickly able to get an appointment with an online option available for booking appointments, digital, mobile, or social media type of interaction, and a telehealth or virtual care option for appointments, offerings, and customer service. Those were the 70% were driving patients to select a new provider. And as you think about that, are you doing all of those? Are you providing that type of service? Is there things that we could be doing in our offices that might change that interaction with the patient and make it more accessible? And what do people expect out of their experiences? Employing technology. Can they make appointments in your office online? And that's one of the things that is certainly something that most patients, not all patients, I think it's part of a certain demographic, that is there an ability for an online option for them to make clinic appointments for you? You know, I looked at our local hospital, our local clinics around where I live. There was none of them that allowed an online option, which I thought was kind of interesting, especially if you look at the data of what patients are expecting with it. But through RevolutionEHR, we easily have that option to book appointments and make those appointments for our patients and have that ease of use. You can also customize it for the appointment slots that you allow to be an online version. Sometimes we don't allow that end of day patient appointment spot to be open as an appointment slot to be selected, just because we like to control what's happening at the end of the day and who we're seeing and what the age group might be, so that we can get out of the office in a timely fashion. The last thing I want is a 90-year-old patient that's new at the end of the day. Automated communication. This has probably been one of the things that we have really enjoyed, and patients really seem to like it. They love the fact that through RevEngage, we can text people about appointment reminders. We can customize it for when they're getting those appointment reminders. We found that the ones that we set up that were the last minute ones, so that they got them just an hour before their appointment, our no-show rates dropped dramatically. And yes, we track all of our no-show rates. Emailing and texting people about when their glasses or the contact lenses are ready to be picked up. If it's going to be something that they have to pick up in the office, we try to automate it so that most contact lenses go out, that they're delivered to people's homes nowadays, just to minimize some of the touch points and make it easier for our patients. But when we do have to have them pick up in the office, they get a text reminder or an email, depending upon which their preferred is, for when their glasses are ready to be picked up. The other great thing about that is that somebody misses their appointment, the next day they're going to get an appointment, or they're going to get a reminder about the fact that they did miss their appointment. So sometimes we'll get patients calling in apologizing and saying, I'm so sorry I missed my appointment. And it's just easy because we don't have staff members that are having to call and remind people about these things. The two-way texting capabilities that are available are just really amazingly easy. Patients will oftentimes send back text messages saying, thank you for the notice, I'll let you know when I can come in, or if we have some way of it communicating with them about something else that they have a question about. And the big thing is making sure that they're HIPAA compliant messages. Some of the fines for breaking HIPAA rules are up to $50,000 and 1 year in prison. So be very, very, very careful of how you are communicating with your patients when it comes to the HIPAA compliant options. A standard email is not HIPAA compliant. The dashboard for RevEngage is really interesting too. You can have people on wait lists. You can find out who's been confirmed as far as their appointments. You can have email or text message reminders. The staff has really been loving this because they can easily look and see if a message went out to a patient that reminding things. And if somebody hasn't confirmed their appointment, we have far fewer phone calls that we have to make, fewer patient touch points, because we've already been in touch with them in a more electronic fashion. Patients really love this. Even in the exam room, I get patients all the time telling me that they have loved having the text messages when their glasses are ready to be picked up, or that they loved having the text messages about their appointment reminders, or the end of the exam when I talk about when it's necessary for them to return for the next appointment. I can't tell you how many times a patient has said to me, you'll send me a text when I need to come back, correct? And remind me, because I'll probably forget. So there are things that we have to at our fingertips, if you will, through RevolutionEHR that provide that ease of technology, that ease of reaching out to patients that they seem to really like. And what else do patients expect? The whole experience of having an exam is changing. So how many times do you have somebody come in that now you hand them forms, they're doing signatures, and Maybe they showed up a little bit late. If you can do something that makes it a little bit quicker, where you can do their intake forms online, having a mobile option for that is really easy to use. So that would be something to consider that you could do for making that engagement a little bit faster, quicker, more tech savvy. Patient portals. We're finding more and more that the patient portals are really more important as well. The other day I had a patient come in who had an eye infection that went to urgent care. And the eye infection wasn't getting better, so ultimately ended up in my chair. And what I'm trying to do is find out, well, what was it that you were given that didn't make this particular infection go away? And the patient said to me, just a minute, I'll check my chart. Any hospital-based system that's powered through Epic has the ability to be on my chart. And so patients are now accessing it on their phone, being able to tell me what their health history, what their medications are, what it was that they were prescribed that might make the flow of this patient encounter much easier. So patients are used to that. They're checking their data on our patient portals. And our patient portal is one of those ways too. We've actually been using it to meet the FTC requirements for prescription releases and making sure that people know they can go into their patient portal through our office to have access to their prescriptions. Accepting patients online or payments online. These are all things that are all part of that patient experience, so that if there's a way that you can accept that payment, patients go to your website and they're just more apt to be doing and being engaged specifically with your office. The fourth thing that is about engaging people is empowering patients and offering people their treatment options. We need to do a really good job of educating our patients and empowering them and making them part of that decision-making process. You know, a classic example that I have that I can think of right off the top of my head, I have a friend who is fighting cancer. And she's been empowered by all of her care team to know what her options are for her cancer treatments, what her chemotherapy is going to be like, you know, what all of that might be, so that she's part of that decision-making process. And I think that's really important for our patients as well when we're talking to them about whatever the retinal disease is, their macular degeneration, their dry eye treatment options, their glaucoma treatment options. Any of those educational resources that we can direct people to or give them as they're leaving the office. Maybe it's helping them finding financial resources when they're needed and helping them navigate that, educating them about the digital tools that we have available to us, and encouraging patients to use the portals and look at all of those different things. The more we empower our patients, the more they feel they're part of their healthcare decisions, the more engagement they have. All of this is about patient loyalty. So the more they feel that they've had that excellent customer service, that excellent care from all of your team, not just you, but your entire team, the more loyal that they will be to our offices. And we have so many things that are at our fingertips for educating patients. I will not practice without my OCT or my Optomap anymore, just because it is such an easy way to educate people. And you know, when you're trying to explain to them what diabetic macular edema is or anything, it's so easy now that you can point and say, this is what normal looks like, because you can probably point to the other eye of what the normal looks like. And now here's what this one looks like. That's why you're having trouble seeing with that eye. It suddenly becomes such a great way to engage people and actually help them understand what's going on. As an aside, many years ago, I had a gentleman who came in and he said that he got a drop of oil in his eye. And I'm looking at him, well, he didn't get a drop of oil in his eye. He actually had a penetrating metallic foreign body. And I was trying to explain to him this happened, and he said, no, that couldn't have happened. And I pull up the OCT pictures and I pull up the Optomap pictures, and I said, see that? That's a piece of metal inside of your eye. That needs to be taken care of. You know, it's just a great way to educate people. I cannot emphasize that fact anymore. And then the fifth thing is being ready to be involved or to evolve. So what exactly is artificial intelligence going to do to optometry? You know, I'm still waiting to find out how we're going to be using it, what it's going to do for treatment plans, for care options. But I think that that's going to be the next wave that's happening, and it's already starting to happen in some respects. But it'll be interesting to see just exactly where that takes us. We all know businesses that have failed to evolve. You know, Blockbuster said Netflix will never go anywhere. If you really want to get down to it, if you know who created the digital camera, it was Kodak. Kodak created the first digital camera, and they buried it because they didn't want to hurt their film business. And so, you know, that changes everything when we stop evolving. And part of that is what happens after the patient leaves the office and encouraging feedback, the Google reviews. So I was doing some quick research about Google reviews recently because we've not really promoted that in our office until recently. In fact, we make fun of ourselves. We had 4 Google reviews, 2 of which were because we sent individuals to collections because they didn't pay their bills, one of which accused us as dermatologists that we should be taking better care of our patients and people's skin. So we left the Google review stand because it was just so ridiculous that, you know, I was kind of laughing about it. But we started with RevEngage now a little while ago, and immediately we noticed an uptick in our Google reviews, all of which were positive. I don't have any crazy ones that have happened lately, but stay tuned. I'm sure there's always crazy people out there, right? We all know that. But encourage those Google reviews because 7% of all Google searches in the last year were healthcare related, which is really pretty interesting. And 94% of patients used online reviews to evaluate providers. And we're so, I think, in a place where you don't know people as well or what to do. My son lives in Florida. He called me up because his air conditioning started to go on him and he needed somebody. And immediately I went to Google reviews for HVAC companies down in his locale. I mean, and I found myself doing it. And if you look at it, the statistics show that 94% of patients use it to review us and look at whether or not we're going to be a good clinic to go to. Encourage that feedback. Because at the end of the day, that patient experience directly affects our reputation as healthcare providers. And with the digital era that we're in, social media, word of mouth, having positive experiences online, positive patient experiences, so that somebody actually reviews us and said that we were a great clinic to work with. Negative responses hurt us as well, unless you get called a dermatologist. But you know, that probably doesn't hurt us very much if anyone knows that they're searching for an optometrist. But it's about trying to create that experience. And then finally, just staying in touch with patients when it's all said and done. Almost 73% of Americans use social media in 2023. 73%. Most of them on their phones. The vast majority. And Facebook and Instagram are the 2 most common social media forms that people look at. So the presence that we have in any of those places obviously makes a difference with what we can do with staying in touch with our patients. And so what I did is I went back through and I went through every post that we had on Facebook or Instagram for the last year and a half, and I looked at engagement. Ads like this, not one click, not one single piece of engagement. Yet we pay for this. So it's kind of interesting. Okay, I'm paying for this, and it makes me kind of think, well, should we still be doing that? And so far, I haven't pulled the plug on having something that's a canned paid advertising, because eventually, I mean, it does show up in people's social media feeds. However, these were the ones that had the most engagement. Infancy. We belong to infancy, and with moms or dads or permission, we always post a picture, never using full names, but we'll say Dylan was in today for his first eye exam. I cannot tell you how many times those posts are shared, proudly shared by grandmas, aunts, uncles, moms, dads, anybody who thinks that their friend's child is cute, and those by far get the most engagement for anything that we've ever posted with our social media feeds. A while ago, we also started doing something interesting with one of our ideas from one of our staff members was Frame Friday. And every Friday, one of our staff members picks out a frame line that they really like, and we do some little profile on it, whether it's been DKNY or OGI or the 2 blind brothers started a frame line recently, and they actually named a frame after me, Dori. So we've had some fun with that. And those kinds of posts have really gotten a lot of engagement. And anything to do with our staff members, really. When it came time for the eclipse, this was one that got a lot of engagement, and people were commenting about this, and just the fact that we had 2 staff members go outside and snap this photo as if they were looking at the eclipse. And the other one that got a lot of hits on it was the fact that we went and did a major renovation of one of our locations. We gutted the entire optical waiting room area. We were shut down for 7 weeks in that particular location. And oddly enough, 7 weeks, and I believe we were down 1%, and that was it for even being closed for 7 weeks. But the office took on a whole new look to it, and we did this little video of it. And we got a ton of patient engagement just because everybody was really interested in that. In fact, during that whole entire time, we would post video updates all the time or little snippets all the time. And patients would stop me in the grocery store and say, oh, we love the look. We love the fact that you're posting this on social media so that we can stay in the touch and know what you're doing in the office and what we can expect to see later. So it's about that whole engagement process with the technology, with the culture, with everything that happens with it, and staying in touch with people after they're out of the office. Because according to that same 2017 study that I cited at the beginning, is that effectively engaging patients in their care is essential to improving outcomes, satisfaction with their care, reduced cost, and benefiting the clinician experience. Because after all, when we're talking about engagement, we're talking about loyalty. So it's the same circle about establishing that vision, creating that culture of engagement, employing technology that's at the tip of our fingertips, and making it really easy in a day and age where maybe you don't have a full staff, and trying to make it easier so that your staff can spend more time with patients in the office instead of doing the minutia of calling patients when their glasses are ready to pick up or any of those items, empowering patients in their decision-making process and being ready to evolve, and then making sure that we stay in touch with them after their experience and making sure that they're part of our whole clinical experience, because that's what loyalty is all about. And as I said earlier, healthcare organizations have learned that the more loyal people are, the better their experience is, the higher their profit margins are. What's good for the patient is good for the practice. And with that, I'm going to hand it over to our folks at RevolutionEHR.
Thank you, Dr. Carlson. So here is a bit of the workflow of how RevEngage works right within your RevolutionEHR environment.
Hold on one second, Kristen. I think your screen was just taking a second to load.
Okay.
There we go. I think we should be in business now.
Great.
Okay.
All right. So most of the people on this webinar, I believe, are current customers, but a fair amount are not. So I'm just going to briefly go over what RevolutionEHR is before we dive into RevEngage. So we have our all-in-one practice management, optical, and EHR system with Rev, and it's very easy to navigate and customizable, and you can really organize the workflow in the way that you prefer. So RevEngage lives right within Revolution, right up here. And so it's still a single sign-on, so all you have to do is click into RevEngage, and you're brought into your patient communication system. So we have here our main dashboard that shows our stats for the day, patient retention, rate of reappointments, as well as confirmed appointments. We have our main inbox here. And so I'm going to focus in on this inbox for just a moment here. So you can see here that instead of having to type in a message every single time, you can actually have templates that you can grab from. So say if somebody doesn't have an insurance card on file and you didn't already receive it through RevIntake, you can ask them to send a photo of their insurance card. With RevEngage Plus, you can also send a photo back. So there are 2 different tiers of this product, which we will get more into the nuances towards the end of the presentation, but there's RevEngage Regular and RevEngage Plus. So that's a feature that I like, is being able to receive photos with both products. Now, to Dr. Carlson's point, being able to see an uptick in your Google reviews is very helpful for the success of your practice. So you can either send reviews automatically after each exam, or you can also send a review request to an individual patient via the inbox. So using this lightning bolt, you can send a review request, or you can also do it from the reviews section, which I will get to in a moment. So that's the main inbox. We have the ability to flag a message, and so if you guys want to assign it to a specific color for a specific person, you can see all of your filtered messages here. And then if we go to the review section, actually I'm going to pivot and show you the broadcast. So a feature that I like that's an upgrade to RevEngage is the broadcast feature. So that's basically going to be a text blast. So you can either do it from a schedule, which is from a specific date range. You can select specific patients from your patient groups. Now that's available in RevEngage Plus. Or you can do it from an exported RevolutionEHR report or your own spreadsheet. So if we select a spreadsheet, you can do 500 contacts max, and you can do more than 500 if you're going to do an email broadcast. So we'll get to that in a moment as well. But I think that's a great thing to have, because say if you have a emergency office closure and you want to notify patients that are coming in between a certain time period that you will be closed. So you can easily communicate via text or email to all of your patients scheduled for that specific time. Now with email broadcasts, those are called campaigns. They live right in this tab. We have all of these preloaded default templates for you. So we have stock photos for you, and templates that you can easily select, or you can create your own template with your own photos. Now, if I select a template, we can either do it to all of your active patients. You can do it for similar rules to the text broadcasts are going to apply here to the email campaigns, except for you can do it to all of your active patients. And so, you can also do it from the schedule, from an exported Revolution report, individual patients, and then you create your variables and add your photos, and then it's ready to be sent off. Now, one other thing I want to go over is the customization of your templates. So say if we have an appointment reminder request or a confirmation request, you can edit your templates for every single type of reminder that you have, and you can create as many reminders as you would like. And you also have the option to do a family text message. So you can check mark the call button, the text button, the email button, starting however many hours or days before the appointment. And if you have RevEngage Plus, you can add a filter that sends it to specific patients from a patient group. And I will get into patient groups in a moment here. But one other thing to note is we have our birthday reminders with RevEngage Plus. We have a missed appointment notification. This is available in both tiers of the product. And so if you mark an exam as missed in Revolution, it'll automatically notify them after the appointment has already been missed. One other thing I like about RevEngage is the ability to customize your optical orders. So you can change the verbiage for A-frames, message versus a contact lens message. So if you want to notify patients who have a message or a optical order that is marked as verified or received, you can then go into this text template and say, hey, your optical order is ready, or more specifically, your frames order is ready. So that way, if they have multiple orders pending, they know exactly which order is ready. Now, one other thing that's great about the reminders with RevEngage is the option to do call reminders with RevEngage Plus. So this is essentially a robocall that will notify patients that maybe don't receive text messages, or maybe they're above a certain age and you want them to have the option of a call versus a text. So you can easily change that verbiage right in here. You have up to 450 characters. And you can customize who receives a call message, who receives a text, who receives an email, all with the option of RevEngage Plus. Now, the ability to do customization of as many confirmation requests, order notifications, and missed appointment reminders, that's all included in your regular RevEngage. So it's still very customizable. You still get a family text or email, but it's just a bit more customizable and tailored to your practice when you're able to customize who you send it to at what time. Now that's available to you with RevEngage Plus. And now these are the patient groups. And so if I create a patient group that for a specific practitioner and a specific encounter type, as well as patient age, patient gender, active or inactive, I am then able to quickly go into my text broadcast, my email campaigns, or my general reminders, and I'm able to customize the type of communication I would like for those specific patient groups. And to again show you what that looks like, if we go to our inbox here and I select a broadcast, I can quickly grab that patient group from this section. Again, something I would like to show you is the reviews section. So we have all these different tabs available to you, basically making it very easy for you to check how you guys are doing with your Google reviews, your reputation management, and everything that involves. So we have our main overview, our feedback and requests, our daily review, our public reviews, and our settings. So I'm going to go into the overview section right here and show you that all of our Google reviews will populate into Revolution. And then we can quickly send an additional review request from this top right box. Now, to remind you, there's a few different ways to send these review requests. So we can do it automatically after an appointment has been completed. We can do it from the main inbox with that little lightning bolt, or we can do it from this quick send option. Now, if you send multiple, you can also upload a spreadsheet. Another thing I like about our reviews is that you can set it to auto reply. And it's very intelligent because it does not send the same response every single time. It waits a little bit after the review, so it's not extremely obvious that it's a robo response. And you can also kind of control who you send this to. So say if you don't want to manually have the settings on to send out to every single patient. Now you can individually send it. And even if it sends out to everyone, I like this red button option because it encourages patients to give any negative feedback on this red button. Now you're only going to receive that feedback internally if they click here. Now, if they click on the Google or Facebook, that will prompt them to leave a Google or Facebook review. So that is a very high-level overview of RevEngage. I do encourage you to reach out to your rep for a more in-depth demo, as well as a quote that's specific to your practice. And I will pause for any hand raises or any questions.
Thanks so much, Kristen and Dr. Carlson. Kristen, I think your mic is still on.
Okay, thank you.
Let's see. No, you're good. Okay. Well, thank you, Kristen and Dr. Carlson. Today's healthcare landscape is so competitive that differentiating your practice and your patient experience truly is key. Like we all kind of know from our personal interactions with our own physicians that when you feel connected to your providers, you're much more likely to stay with them long term. And one of the best ways to strengthen that patient-provider relationship is through communication. So that's why having tools in your day-to-day EHR and practice management software like RevEngage to handle and streamline that communication is going to make it managing those relationships so much easier for both your patients and your staff. At this time, I'd love to open it up to some questions. You can type them into the chat and we'll get to as many as possible. And while we're waiting for any new ones to kind of bubble up, I do have a few that have already come through. The first one, Kristen, is actually for you. It says, what are the couple of main differences between RevEngage and RevEngage Plus?
Yeah, so I'm happy to go over that. So a few main things are going to be those patient groups here. So you can still fully function with RevEngage regular version, but this is going to be really helpful for a larger practice that maybe has multiple practitioners, encounter types. Maybe you have special instructions that you would like to include in a reminder message for an appointment reminder, for a specific encounter. So you can go ahead and change the verbiage for that appointment reminder right within your appointments. And then I have here my template for a confirmation request. And so you can set as many of these reminders as you would like, and you have your templates for each reminder under each confirmation request or just general reminder that you have set up. So we see our kind of parent reminders are right here with this wheel. And then underneath that subcategory, we have our text templates, our family text templates. And so you can set up as many of these as you would like to. So if I have a, confirmation request, and then I can also set up a confirmation request and call it, confirmation for comprehensive, and then I can change the verbiage of that. And then I can also add a filter here that sends it to, patients with comprehensive exams only. I also like the ability to, create that broadcast off the fly. So you not only can do it from a schedule or your uploaded contacts list, but I can also do it from a patient group. And then I would say the other main difference is going to be the ability to send photos. So you can still receive photos with RevEngage regular, but if I want to send a photo back with RevEngage Plus, I can maybe send a picture of new frames that we have in, or send a picture of the insurance card that we have on file for them. I still find that most practices that I speak with say that being able to receive photos is more than sufficient for them, but this is a nice added bonus. We also have the ability to do our wait lists through RevEngage Plus. So if I go to my wait list here, I can add a new opening, and I can notify all of my patients or specific patients of an opening. I guess you wouldn't want to do it to all your patients, but I can notify my wait list of an opening, and then it will send them a follow-up message if that opening has already been taken. Lastly, I would say the main difference is going to be the ability to send those voice reminders and also the birthday messages. So I think that answers that question. So I will pause for any more.
Great, thanks, Kristen. Our next question is for Dr. Carlson. And the question is, how often do you use patient surveys in your own practice? And have you been able to make any changes from feedback you've received so far?
As I said before, I lead by being authentic and saying we haven't done a patient survey in a really long time. But the funny thing is we did do them like 2 or 3 questions, make them really super easy when you do them. And when we last did it was before COVID, so I'm going to be really honest about that part of it. But it was about the fact that if there was anything that could be changed, and it was the comment about the magazines that we had in our waiting room, of all things. So, and now with COVID, we probably took out most or the vast majority of magazines anyway. So now it's kind of funny when you say that. But what I've learned when we did do it is that if you make them super easy, 2 or 3 questions, just simple, easy, a box to drop them into is one way to do it. You could probably use RevEngage in order to do some of the patient surveys. And my staff does that more than me. So the Revolution people would be the people to ask about that part of it. But I've also seen those smiley faces, happy faces, the sad faces in bathrooms like at airports. That would be an interesting way to do a survey as well.
Great, thanks, Dr. Carlson. And we actually have another question for you as well, and then one more for Kristen so far. Dr. Carlson, the next question is just, have you noticed an increase in patient satisfaction in general since you've been using more automated tools like scheduling and pickup reminders for contacts and things like that?
Absolutely. That's the fast answer. We get so many comments all the time about the technology tools that we've been using and the way that we've engaged people in that respect that I can't even imagine practicing without it.
That's great. Kristen, we have another question for you. When sending out emails or text messages, will it show that it was sent from our practice number, or will it be a random number or email?
So if it is a traditional landline, or say something like Ring Central VoIP, we are typically able to use that same phone number to show up as your texting number for RevEngage. However, there is no guarantee. This can be a case-by-case basis. So if that's like a deal breaker for you, we can definitely test that phone number before we sign you up for RevEngage. For example, if you have something like Solution Reach currently and you're using a local phone number to serve as your Solution Reach number, we can typically use that same phone number, but there's going to be a release form that is signed. For example, maybe something else that wouldn't work is, say if you had Weave as your phone system. Now, since Weave is a competitor, they wouldn't necessarily release their phone number. So I do encourage you to reach out to your rep about that. But that is a great thing about RevEngage, is that in a lot of cases, we can use your same office phone number to show up as your texting number. And if it doesn't work out, then we will assign you a different phone number. So it still can work for everyone.
Great. Thanks, Kristen. The attendee says thank you for answering my question. And then Dr. Carlson, I have another one for you. It says, has your staff been quick to get on board with all of these changes? I feel like it can be hard to balance sometime implementing new processes across multiple locations.
That could be a problem. I agree. What we did is, so we have 2 locations, and we assigned somebody in each office to be like the person that was in charge of the tech to learn it. And that they in turn were the ones that taught their coworkers how to use the technology. And I think it's a big part of what is happening from the top, because every decision that happens and how we engage, how we promote things, if the leader of the office doesn't believe in it, I can guarantee no staff member is going to believe in it. But if you as the leader say, hey, I think this would be a great idea, and then I've had pushback, and then when we've done that and implemented things, I've said, okay, just 3 people today, or just pick some really easy goal. Let's just try it 2 or 3 times. And then when they find out that embracing that is not as difficult as what they say, and they get past the mindset, because it's all about mindset, right? Once they get past the mindset, then they realize that they were trying to make their lives easier. And I think it's how you pitch it as the leader.
Those are some really great suggestions. Thanks, Dr. Carlson. And then, Kristen, we have another question that's come through for you. How does RevEngage work with RevIntake?
So I wouldn't think of RevEngage as a replacement for RevIntake. They both serve their own purposes. RevEngage is more for your reminders, recalls, patient communication, and engagement. And RevIntake is more specifically for those intake forms that integrate directly into Revolution, into the chart. And so I say having both is going to take care of everything that you need for your practice. And we actually do have a bundled discount for both if you go with both RevIntake and RevEngage. And so I do encourage you to reach out to your rep on more information for that. And they can do a specific demo for your practice that's more tailored to you and your needs.
Great. Well, I think that kind of covers the bulk of the questions we've had so far. I know everyone has full days and patients to get back to. So I just want to thank you all again for being here today with us, and a huge thank you to Dr. Carlson and Kristen for sharing their expertise. A very short survey is going to pop up after the call, and we'd love to have you answer it. And if you have any other questions, feel free to reach out to either your rep if you're a current rep customer, or answer this short survey question, and we will make sure to get in touch. Have a wonderful rest of your week, and thank you again for joining us today.